Hello, everyone. Good morning. Welcome, sir. Good morning.
Good morning.
Welcome all to our webinar on futuristic nursing, organized by Society for Nursing Practices and BioLeaks Worldwide. And today we are being joined here by Dr. Dinesh Selvam. He's Dean of Studies, Medical and Paramedical Science at Dr. Mohan's Diabetes Education Academy from Chennai. Thank you, sir, for joining us today.
Yeah,
And thank you for all the viewers and the one who are watching us from YouTube as well as who have joined us in the live webinar. Thank you all for joining us today. And without any delay, I'll move on to Dr. Dinesh Selvam, sir. So would you like to begin with an introduction?
yeah. Thank you for moderating the session, and I extend my thanks for the organization, the Society for Nursing Practices. They are doing wonderful for the nursing professional, and it's a very great opportunity for all the nurses to be the member of this SFNP and avail their benefits. So on this occasion, with their support, thanks for inviting me as a speaker. And to say a few words about me, I am Dr. Dinesh Selvam, who has completed PhD in nursing. And my main area of research was in public health nursing. And today I have going to present you about futuristic nursing. So shall I go directly to the session?
Yes, sir, you may begin. Thank you so much. You
Yes.
may begin, sir.
Yeah, thank you. And this futuristic nursing, when we say we are going to see about what's going to be the future in nursing and how it is being accommodated in this 21st century. So the session we will see in three areas. One is in practice, in research, and in education. To say something about futuristic nursing, the term itself, it denotes you something innovative or something revolutionary. So what's so innovative in nursing? In future, that we have already started practicing. There is the action of introducing anything new idea or a product. So what is new in nursing that's happening in India? It is time for nursing to question and redefine its role within the systems, to take steps to bring about the future that the nursing profession is to achieve. These aspects of future nursing we can see in three broader areas. One is in practice, another one is in research, and the next one is education, as I told you. Yeah, practice in nursing, there is a scope for advanced practice nurse, which we is a big umbrella term, but this where all the registered nurses are being put under this advanced practice nursing. But their advanced education and clinical practice requirements all gets into various areas. The areas for future nursing practice we can see in different aspects. One is in mobile nursing. So, mobile nursing is a service agency which is cropped up in many cities in all over India. I know well, where they are going and providing home care for the patients, where they hire nurses and they send them to the home care treatment for the patients who are referred by the hospital or by their own also. This mobile nursing has given a new trend where we can see the patients getting discharged earlier from the hospital. So no need to stay long in the hospital. They can continue their follow-up care through these mobile nurses from their home. Mainly, this is for chronic and acute medical problems. Surgical patients who required post-surgical dressings and post-surgical treatment or care, and patients who require IV therapy. Elderly patient who need assistance, the patient with a respiratory problem and respiratory assistance, a seriously ill patient, and the patients who need medication often, and hospice care, of course, ventilator dependent patients can be continued with the help of these mobile nurses, and assistance for the any patients who need assistance in daily living can be achieved through this mobile nursing. Space nursing, as the name denotes, it's nice space nursing, but not practiced in India. And these space nursing people evaluate the emergency plans and they utilize medications in space and telemedicine opportunity, performing surgery in space. So this is going to give a forum for discussion and explore the issues related nursing in space, which is on development. Forensic nursing, of course, is not so famous in India, but forensic nursing, as such, it helps to investigate crimes and any physical assault or accident death, which they are going to come as a very good scope. And they are going to collect this evidence, medical evidences and criminal justice system, which needs a long way to go. Genetic nursing, of course, aims in giving the fundamental nursing practice based on the genetics, so they can recognize the individuals at the risk, if they are having certain genetic problems, risk of certain disease or illness, when they are conceiving children, or facilitate drug dosage, selection of certain illness or specific patients. Robotic nursing, very famous and very familiar. Even in this time of Corona, we have witnessed the function of robotic nurses in all over the hospitals. So this robotic nurses will help in administering the patient care and support the administration also in the hospital and any care facilities. So they assist nurses, or sometimes they do the complete task of the nurses based upon the task. This robotic nurses are very successful when they are taking care of old age, and they are more accurate than human, and they can even lift any heavy patients if it is required to transport a patient, and they are no. It's so good to know about this robot nurses and its emergence. See, that was about certain aspects where this future nursing is going on. Now, switching it to nursing research. It's a very wide scope of research nowadays, and research is very important in nursing. It gives us the professionalism, and there is a need for more evidence based research, which the nursing is coming up. Now, the future of nursing research is going to promote excellence in nursing science. So, as much as the nursing science and evidences are collected, which is going to help the future nurses to intensify their care and to give a quality and standard care to their patients. What are the trends that is future for the nursing research? You can see the focus on evidence-based research is growing more, and systematic reviews are getting their importance, and there are also emphasis on meta-analysis, and translational research is gaining its importance, and the research in multiple site getting importance, and a strong interdisciplinary research. This is a very, very important and a positive sign in nursing and in healthcare nowadays is getting its importance. And previously, compared to previously, there is now more expansion in the dissemination of the research, and there is more increased visibility to research, and there are more scope coming out in online research. This evidence-based research, you all know, I'm just giving, when you see this picture only, you can see how the evidences are given importance. The first evidence-based research, the first priority given for systematic reviews, and it goes on. There are lots of evidence-based infection control policies which have come into the hospital. And nowadays, the importance of NABH accreditation has given more importance to come out with this evidence-based practices and policies in the nursing and in the setup. And systematic reviews, it evaluate the findings of relevant studies over a particular issue, and they make that evidences available and more accessible, so that a decision can be made in favor of that particular patient care. So, for an example, there are strategies to manage the behavioral symptoms associated with Alzheimer's disease. There are various studies in summary based on this particular study being gathered, evaluated, and systematically reviewed through statistical analysis, and it aids to take some important decision on treating the behavioral symptoms associated with Alzheimer's disease. This is an example for systematic review. Yes, meta-analysis. It is completely a statistical analysis. It combines multiple studies, and it can give each individual, the researcher, a clear-cut analysis report on the findings, which is going to help them to know the care for the particular patient. Translational research, it's very important, because there are various researches being done at the institutional level, or at the student level, or at the working level. So these researches should be transformed or translated to the practice, And this translation will give a new knowledge into the clinical practice, which in case going to improve the quality of the patient care. So this translational research, we have just quoted an example where mothers with infants having sleep problems had double chances of developing postnatal depression. So a study was developed to find out this intervention program, this sleep intervention program, so that the mother's postnatal depression can be reduced. So this is an example how a translation research can be performed. Multiple site research, which was not so familiar in the previous days, is gaining importance. This is the nursing practice in different areas. They can allow a large sample size, a broader sampling, and they can get a faster, accurate rates when they are doing this particular research. Interdisciplinary research is very essential for a nurse because nurse is one of the important member in the disciplinary of health. So here the nurse needs to collaborate with all the other disciplinary in order to give a efficient patient care. So now researchers are also being focused in these areas where the nurse can collaborate or get involved in the research activities or in the research. If a psychologist is doing, a nurse can be involved, or a medical person is doing, a nurse can be, or a nurse herself being the primary investigator can get the help of the other specialty or the other discipline in order to come out with the strong findings to help the clinical care. Yes, dissemination of research. Previously, there were researches done, but dissemination of research was very difficult for the researchers in order to publish the research in various platforms. Now we have lots of wider aspect of this dissemination of research. There are research dissemination being done in a lot number of journals. That wider visibility has come to the nursing researchers. Even Society for Nursing Practice itself is an example of how the publications and the research of the modern researchers are being acquired and reviewed and being published in their journals. So in this way, there are lots of tools which has increased the visibility of nursing. These tools you already know. Social media, you can publish, and you can publish in various online journals. And as I am again and again telling about the Society for Nursing Practice gives a very good platform to all the researchers to publish their research in their platform and to make it visible to the world. There are lots of online journals which are very helpful for nowadays for the researchers to publish their research and to get disseminated to the large number of population. What are these advantages? See, the advantage of online research, you can have an access all over the globe, and they can come out with lots of data, and they can even be a platform for a particular tool to collect information. They themselves can be a tool to collect various information, and it needs only a minimum investment of time and resources comparing to the paperwork. And there are lots of digital technologies which is coming in advance in nursing research. We already know about this big data gaining its importance in the field, where there are large number of data. See, you have a person working in a hospital for many years, a nurse working in a hospital for many years. In any specialization in the hospital, they have lots of data. They have lots of data. They have lots of exposure in that particular patient care. So what they can do, they can pool, they can analyze this data, and they come out with various findings. So this is how digital technology is helping in nursing research. It shows the way for online research. It shows the way to how to handle data in the online data collection as a method, and you can digitally manage the lots of data which is being pulled by a particular nurse in that particular area, isn't it? Right. This was about the nursing research, which I wanted to throw you some light on it. And now we will see something about this nursing education. Nursing education also in nowadays has come out with a different shape. So previously, the nurses were going to the schools and to the hospitals. They are attached institutions to study. Now you yourself know, after this corona impact, the online or the technology importance in nursing has gained its importance. The nursing education, already the transition has been made, I can say, where the chalkboards are replaced with smart boards. You would have witnessed this in great institutions. And reading out of textbook to reading leveled readers. No, nowadays they are not sitting and reading the textbook. And this paper and pencil has been changed to digital learning. Nowadays, no one is taking notes in the paper and pencil. Sometimes they take notes even in their smartphone. So these are some of the learning and teaching digital citizenship, we say. Right, we have a lots of thing in the digital learning. One is books with CD. There are smart classrooms equipped in many institutions where they can incorporate many of the digital ideas when they are taking the classes. There are lots of e-books nowadays. Going in purchasing books that is being done through electronic media, and there are lots of electronic books where a student can immediately refer and learn about any of the topic. Smart board, as I already discussed, virtual learning, where they are creating a virtual environment so that the student can learn about the patient and the patient care virtually other than going to the exact setting. Yeah, technology in nursing education, we can see in various ways. One is online education, which is happening now and gained importance. Previously, nursing was not given in this platform of online education. There were very little scope through online education for nursing. They were mainly depending upon either the patient side learning and the classroom learning. So, classroom learning and practical. Now, because of the emergence of online, there are lots of scope for online education for nurses. Then there are lots of softwares. So these softwares are even helpful in assessing the nurses' education or conducting any kind of examination for the nurses. Google Classroom, you know the technology where Google has come out with the classroom technology where you no need to go physically to the class. So which was very helpful and very beneficial during this lockdown time where the students were not allowed to go to the classes. They were using this Google Classroom and online classes. Zoom teaching, the another software where teaching happens in Zoom, or certain technologies which has gained more importance during this period and in future also. And simulated environment, right? See, previously, in order to demonstrate any kind of procedure to the students, we have to take them to the lab, or instead of taking them to the live patient in the particular ward, a simulated environment is created in the lab, and it gives more learning experience for the student other than learning it from the direct patient who will be suffering with certain illness. And no, it's very difficult to go and disturb the patient at the time of teaching. But simulated environment has replaced this kind of difficulties. Virtual patient simulation, the other technology where they can bring the patient simulation is there. And a task trainer is another technology where they give a task and it is being trained through the technology. And standardized certain patients, for example, a patient with diabetes mellitus. So how the patient will be showing its signs and symptoms and what is the care being standardized and it is being taught to the students. And of course, the other technology, social media and mobile technology, which has gained very much of varied importance for the students. Nowadays, students before going to the class, they can just Google the particular topic, and they can learn previously before they go and attend the class in live with the teacher. And also, social media has come out with various informations, feeding with the students and the public related to all the topics, isn't it? Learning management system is another software where basically this online education system operates. So this learning management system is a software program. So this particular program can be given as a learning process to the nurses. Now, for example, the nurses after finishing their basic qualification, they work in a specialized area. So they want to read more or they want to learn more on that particular specialization. For example, you can take this diabetology. So we have developed a diabetes nurse educator course through learning management system where the complete software gives the details of the particular course and will guide the student how to get learned and the evaluation based on the online itself. So the particular software takes care of the entire program. At the end of the program, the software says whether the student has learned or how much points they have gained. Based on that, a certificate can be provided to the particular learners on the topic. This is called learning management system, a particular platform or a software system which is gaining more importance nowadays. Simulated practice. So we were saying about simulation lab gaining more importance in all the nursing institutions where the trainees practice a procedure in a routine in a simulated environment. So this they can have a experience of learning it from the actual patient when they are creating it through different scenario and equipment in the particular lab. What are the pros and cons of using this technology? One, it improves the safety and patient care. It's time saving for nurses, of course, and cost saving investment for healthcare facility can be cut short, and it gives you the best practices or evidence based practices can be developed. It enables skills through online or even through offsite, and it can increase the proficiency of the nurses to perform, and it responds also to nursing shortage. Now, what happens in the cons is, see, sometimes there is no human touch. We used to say when we studied high tech versus human touch. So whether we have to go with the high technology or whether we have to go with the human touch. See, basically, nursing is a care which provides human touch. So we see that sometimes the human touch gets missed because of this kind of technology in nursing. And it is not viewed as time saving by all the nurses. Some nurses think it's not time saving, and there are gaps in learning and learning styles. So when we go for a learner who has completed and who wants to upgrade, and depending upon their age, there is a gap, and even the generation gap. For generation like us, where we were learning through chalkboard and through writing notes, it's difficult now to adapt to the online system as easily, isn't it? But this generation are very much good enough in handling any kind of the technology, and they may find it very uh, helpful also. So it may be replacing the critical thinking problem solving skills is doubtful because it's a standardized and simulation learning. But actually, in the practical setting, you will be coming out with more problems and how you can solve. So your critical thinking skills will be more in the case of direct. Right. Now, this technology in nursing research and the technologies and the future of nursing education and the changing system in the healthcare has really forcing the nurses or the future nurses, or they are going to be like superheroes where they have to be aided by the technology, isn't it? No, technology innovation in the practice, technologies in the research, technologies in the education. All these three has put the future of nursing into a different perspective. So no more we can think about the nursing as a very old nursing or a traditional nursing. They are getting modernized. So how they are getting modernized? See, one main thing is these nurses are completely aided by the technology. So they are, we call them as a magic. How they are thousand-handed gods now and goddesses in many hospitals, because you go to a unit, nurses perform a lot many tasks, isn't it? They are multi-skilled. They run to the patient to attend their care, and they run to the doctors or to any discipline who is coming into to collaborate with them. So they assist lots of medical procedure. They prepare the patient for the surgery, post-operative care. They check vital signs and they draw blood for the investigations, give medications, check IVs, carry out administrative duties apart from patient duties. They prepare themselves in the ward to be ready to receive the patient, and they have to cooperate with the entire physicians in the particular hospital or the entire team, the rehabilitation team, and with the prevention task. They have to help the bedridden patients, maintain hygiene, check the distribution of the nutrition in the hospital food. They should keep the ward and the medical devices very clean and get disinfected, isn't it? We can just keep on telling about the functions of the nurses. Really, they are goddess in any area of the medical practice, and they need 1,000 hands to perform all the tasks at one time, isn't it? So we call them as a magic many times. Nurses do magic in the area. Now, how this technology getting to be molded with the nurses? So with the robotics, one, they can cut back some of the monotonous tasks. Nowadays robotics are used for medical management, disinfection, right? They carry the medical devices from one place to another, and when a bedridden patient is there, they very easily lift the bedridden patient. They navigate, they transport them, they greet the patient, their relatives in the hospital. So this kind of task can be done by the robots with the support, where they are supporting the nurses of their functions, right? Then robotics are also used to transport medical devices, drugs, laboratory specimen. So after collecting the specimen, it has to be transported to the laboratory, and they make the supplies, this kind of supplies very easier. They can carry around a multitude of racks, carts, or bins around the clock, and they both could enable nurses to spend more times with the patient. This kind of duties, when it is being shared with the robotics, nurses can give more attention and time to the patients rather than running from one building to the another to carry out all this. And robotics, they help nurses in hygiene. And this you have seen in the COVID time in India, where in some of the South India, some of the hospitals, they were making use of robotics to give the sanitizers and to sanitization, where hand sanitizers and other disinfection was carried out by this robotics in that particular space of the healthcare. And also there are some other robots where they can lift and move the patients in and out of the bed into wheelchair. So from the bed you can transport it to the wheelchair, and from the wheelchair they can transport it to the any other departments, or they can carry it to any other department. They can help the patient to stand, and they can rotate the position of the patient so that the prevention of bed sores can be done mainly to the bedridden patients, right? And the other aspect is telemedicine. See, telemedicine, which already gained importance in India through ISRO, where they were able to focus on the remote patients, the patients in the remote area where they are not able to travel, they don't have facility to travel to the cities to get the modernized treatment. So some of the hospitals, they have developed this telemedicine, which is a practice of counseling patients to the telemedicine through the nurses in that particular remote area from a health center can call the patient to the telemedicine room, and they can assess the basic assessments, and they can connect them to the physician if they need it, and the nurses themselves can give counseling to these patients. See, telehealth medicine can be used both in emergency and non-emergency. Now you take this COVID time, post-COVID, even the doctors are giving only teleconsultations, isn't it? So teleconsultation and telemedicine has gained more importance during this period. And nurses can monitor patients' oxygen level, heart rate, respiration, blood glucose, and more. And in non-emergency situation, they can get their patients' blood pressure, even glucose readings, for instance, can be done, and they can instruct the patients through tele how to take care of themselves. And medical 3D printing will be also a futuristic, where lots of medical procedures and critical aftercare to the patients can be done through 3D printers, and access to the tools that is going to significantly improve the process. So what happens, the exact model of a particular body part or the organ can be done through 3D, and it can be used in the. There are portable diagnostics for improved patient care. Where we try to stop patients being carried to the another area for the diagnostic test, and we have a portable diagnostics which travels to the patient area. It's a device, so it can faster the nurses to take care of the patients, isn't it? Like ultrasonography and catheterization, all this help the nurses, and they can also get minimized through this radiation exposure. Medical imaging all becomes fast, and the diagnostic procedure itself becomes fast, which may help the nurses for more better patient care. And blood drawing technology, where the patient's veins are accessed to draw the blood. We have technology for that, where it can view the scanners with the use of AR technology. The nurses can view the veins very clearly over the skin via this AR technology, and it will be very useful for the nurses when doing this particular procedures. Artificial intelligence, it will optimize the entire process of the hospital, cut down administrative duties, and it will decrease frequency of repetitive phenomena based on the analyzing vast data sets, connecting the dots, and making predictions. Artificial intelligence is gaining very much importance, which is going to be the future administration. Virtual reality, as we were already seeing, it is no, it can be helpful for education, mainly in the clinical area, where it can train the employees. So any nurses or any employees employed in the particular organization needs a lots of training. This training time and the procedures can be done very effectively through this virtual technology, where the training phase of nurses itself get reduced, and it can prepare the nurses for any emergency situation. So the many procedures of the particular hospital, mainly in CPR and gastric tube insertion, starting and IV and wound care and other. So this platform, we call it as virtual education systems or VR training systems, where the nurses can be trained with interactive patients in the hospital before they are being posted in that particular area. And small robots carrying for pills, where the medication supplied to the patients in the general ward or anywhere can be minimized, and medical management, drug management to the patients can become more efficient when this kind of small robots are used with the nurses. Electronic health records, as we have already seen, even in the research and in the education, this health record, where the particular nursing care is being given to the patients and to the ward large number of days, the data, what kind of care given and the patient response, what kind of procedures done and the patient's response, and the patient's details, and complete history and the complete treatment history and the complete nursing history and the nursing care management, everything can be documented. And this documentation will give a very big data for the nurses in future for research, or even to standardize the care or to prioritize the care to the particular patient with that particular problem. Yeah, smart TVs, you all know, it's a very smart technology, where the treatments and the instructions regarding medications and the discharge summary or the follow-up care instructions, everything can be given very easily in a small tab or a sort of a smart TV, through which the patient can be explained in a very. Previously, nurses used to tell them through mouth or through words. They used to talk to them. You have to follow these instructions. You have to give this kind of care to the wound after the discharge. Now everything can be converted digitally, and it can be given through smart TV, which is going to be very, very effective for the patient also. And automated IV pumps already there, and many hospitals are now very much using it. And this is software incorporated medical technology, where it can, previously the nurses used to calculate the number of drops for different medication depending upon the patient condition, and they have to calculate and they have to see that many of drops is being done for every 24 hours to the patients. But now the software and the medical technology allows the nurses to do it very easily. So no need to go very frequently to change the drips or to change the IV set. So everything is being monitored in a software where the doses are calculated appropriately, and accordingly the drips are being given through this software medical technology. Right. Smart beds, right? Many hospitals are equipped with this technology, where the nurses need to give more physical pressure or effort to tilt the patient or to Now change the position of the patient. Now the bed itself is being aided with some technology, smart technology, where it can entirely monitor from the temperature and many of the important things like some of the medical equipments and even supplies can be well adequately being adjusted to the patient's need. There are lots of telehealth and applications which have developed in the recent days. So this app, we say in this app, are giving more instructions to the patients so that their care can be elevated, isn't it? Of course. And even the nurses, the learning or the nurses care management for the patient are also can be given through the applications. Where certain hospitals, they develop this app and they put their policies also, and also they put their care standardization of the care or SOP you say in their app so that it helps the nurses too. And for the patients also, what kind of follow-up they have to take, what are the nutritional advices, and who is their nurse and whom they have to call, and who's their physical therapist, or who's their trainer, and what kind of health coach they need. All this can be put in the app also for the patients, which is going to help. So these are the technologies nowadays or in future going to gain more importance to the nurses, isn't it? They have to adapt the nurses. They are going to help the nurses in this particular technology. Patient and staff identification system. So previously everything was in record, everything was documented, which was everything in a paper. And nowadays there are lots of things for identification, patient identification system, barcode, which gives the entire details of the patients, wristband attached with the radio frequency. So the patient, wherever he goes, also it can be tracked, and the patient uh, details and what medications the patient is taking, how many days he was admitted, what kind of treatment going on, everything can be tracked. So it will minimize the errors, or even it will minimize the time of searching of what is the patient condition and what's the status of the patient. And it also for the safety of the patient, isn't it? For the safety of the patient, and the hospital can give more safety measures through this particular patient and staff identification systems. So smart alarm technology is there, which is going to monitor the patient's vital signs through one system, isn't it? Blood pressure, pulse rate, etc. Everything can be maintained. Even now, you can see the smart watches which maintains your even your calorie intake, and whether you have done a sort of exercise, how much calories you have burned, what is your blood pressure, what is your heart rate, isn't it? Right. Now, whether the nurses are going to adapt to this technology, or whether the nurses are going to be giving more importance to their traditional practice was the dilemma previously for past 2 3 years or 2 years back. But now it is becoming more evident that the nurses' task can be reduced if the nurses are equipping themselves with the influence of the technology. So the nurses should understand the technology, they should participate, they should develop, they should implement this kind of technologies in the patient care for the better interest of the patient. So nurse, being a nurse is highly demanding, as I am already saying, and the nurses touch the people's or the patient's life, isn't it? The touch and the care what they give to the patient, where the patient feels satisfied, because it's not going to be the physician who is going to be there with the patient for 24 hours. The patient, any need at any time is addressed by the nurse. So the nurses are available to the patient, to the patient care at all the time. In that case, the nurses, we request them, or we, this century and the future, nurses has to collaborate with the technology. They have to get adapted with these innovations. These innovations are going to increase the more efficient patient care, and the nurses should be paying attention with empathy and caring also aided with this technology. But nurses cannot be replaced with the technology. I make this point. The future technologies or the advancements or the innovations in technology will help the nurses, but it will never going to become the replacement for the nurses at any time. So these are my views on futuristic nursing, which I presented in this 40 minutes or 45 minutes on the areas of practice, education, and research. So this kind of nurses in the future, or they are going to be the superpower. You can see this picture, which we depicted very nicely. The nurses are the superpower as always, but they have to get adapted with this innovative technologies and do more in research, education, and practice, and establish themselves as a super nurse and a super power. Thank you for the opportunity. And any questions or any discussions?
Thank you, sir, for that amazing presentation. It was very informative. And thank you all the attendees who have joined us today. If you have any questions, do write to us in the chat box. So we'll answer to the questions. So any information or advice that you would like to convey to our participants listening
You
here?
know, the futuristic nursing and also the present nursing, they have come up with wide open platforms. Mainly, they have to come more in research. This is my great suggestion, because research is a very important thing where they can come out with many evidences and they put themselves to the clinical practice. Previously, the research platforms were less, but now again and again I am just repeating to say about the um, uh, our Society for Nursing Practice and their steps to foster the research thought in the minds of the young researchers and even the students. I think sponsorship is also available from SFNB. They can avail the sponsors for doing more research in the area, and they can even publish their research activities in this particular platform.
Yes, so thank you so much, and thank you for joining us today in your busy schedule. It was very great to have you today. Thank you all attendees. With this, we come to an end of our webinar. Thank you
Thank
all.
you very
Have
much,
a
and
nice
my
day.
thanks to the
Thank you, sir.
organizers uh, for allowing me to just present in this small topic in this small time limit. Thank you very much. Thank you. Thank you.
Thank you once again.